Today we will demonstrate how to do a basic oral exam in the primary care setting. You start off by asking the patient if they're experiencing any dental symptoms.
Hi Chris, how are you doing today?
Good, thanks. How are you?
I'm good. So just to begin, are you currently having any pain anywhere in your mouth?
No.
Okay, that's great. And tell me, how often do you brush?
I brush once a day.
Okay, and how about flossing?
I don't floss.
You don't ever floss?
Maybe the one day a year I go to the dentist.
Okay, alright. So I would recommend you brush twice a day and then floss once a day.
Okay.
Do you see a dentist regularly then?
I did, but I haven't since about 2 years ago when I moved.
Okay. And tell me about what you eat. Do you snack frequently? What kind of foods do you enjoy?
I like all kinds of foods. I snack a lot.
Okay, what kind of stuff?
Crackers, granola bars, yogurt, fruit.
Okay. So if you are a snacker and you're frequently having meals, I would recommend either brushing afterwards or at least rinsing out with water.
Okay.
So tell me, do you know whether you had fluoride in your water growing up?
No, I drink tap water, yeah.
Okay, great. And are you taking any medications that might make you feel like your mouth is dry?
No, I just take a multivitamin.
Okay, does your mouth feel dry in general?
I don't think so.
Okay, great.
And Chris, do you drink any sugary drinks like soda or juice?
I drink diet soda, not much juice. Drink a lot of coffee.
Okay, that's great. Coffee might cause some staining, but as long as you don't have sugary drinks with too much frequency, then it shouldn't be causing too much damage to your teeth.
Okay.
And how about alcohol? Do you ever drink and do you smoke?
I drink beer occasionally, and I smoke every once in a while too.
Okay.
It's very important to ask patients about their tobacco and alcohol consumption because both of these are important risk factors to consider for oral cancer. With that, we'll move on to the oral cancer screening.
Take a 2x2, and I'm going to have you stick your tongue forward. I'm going to wrap this gauze around the tip of your tongue, and it'll help me hold on to your tongue while I look at the tongue.
Okay.
Because this is one of the most common sites to have oral cancer. So stick your tongue forward, and I'm going to wrap this around, and now I'm going to look at the sides of your tongue, and both sides, at the very back of the tongue and underneath the tongue. And I'm also feeling to see if it feels soft or if there's anything bumpy, if it's symmetrical bilaterally. And then while I'm in here, I'm also going to look at the soft palate. Say ah, Chris. Okay. And see if anything looks red or bumpy or unhealthy in general.
Next, we will proceed with an examination of the gums and teeth.
Okay, so to examine your gums and your teeth, I can use a mirror. I can just use a tongue depressor, or I can even just use my fingers. To examine the gums, I'm just going to kind of manipulate your mouth a little bit and look around and feel around to see whether anything feels bumpy or looks red or swollen. And I can look on all surfaces on the inside and the outside and lift up the lip.
In this part of the exam, you want to see if the teeth look abnormally long. This could be a sign of gum recession, which is an indication for periodontal disease and is a reason that a patient would want to pursue further dental care.
So all of Chris's gums look very healthy and pink. No pus, no redness, no swelling, and there's no pain when I'm feeling in the area. So then I can look at his teeth. And again, I can just use the mirror to help me, or I can use the popsicle stick, or just use my eyes. And I look at the surfaces of the teeth to see whether anything is brown, or looks very soft, or if there's a tooth that's broken, or black. I look for old restorations, and everything looks really good.
The purpose of performing an oral exam in the primary care setting is to determine what type of dental attention your patient needs. Do they have urgent needs that need to be treated by a dentist right away, or do they just need regular dental care that can be scheduled for a regular visit to the dentist? All patients are recommended to see the dentist every 6 months for checkups and cleaning.